Welcome back. As the world marks World Mental Health Day 2025 under the theme Access to Services, Mental Health Catastrophes and Emergencies, the focus turns to a vital yet often overlooked aspect of crisis response, the psychological well-being of individuals as well as communities. Now, this year's theme highlights the urgent need to ensure that mental health services are accessible, especially in times of disaster, conflict, or public health emergencies. Crises not only leave physical scars, but also deep emotional wounds, and prioritizing mental health care is essential to rebuilding lives and strengthening community resilience. Joining us to unpack this year's theme and its relevance in the Namibian context is Dr. Hilen Ndjaba, Senior Specialist Psychiatrist and Head of the Department of Psychiatry at the Windhoek Central Hospital. Dr. Ndjaba, good evening and thank you so much for joining us.
Good evening, Nina. Thank you for inviting me.
Well, as I mentioned, this year's theme focuses on access to services. What does this theme, first of all, mean to you, Dr. Ndjaba, and why is it particularly important in today's global and local context?
In fact, why I'm here today, I would just want to share with you and the whole Namibian nation. And I want to remind each one of us that these 2 months, September and October, become very important in the history because it's when we are commemorating mental health awareness. Of course, in September, we started with suicide prevention.
Yeah.
And now in October, and these two things are being commemorated together. It's a continuation. And of course, now the 10th of October is where now we are commemorating World Mental Health Day. As you have put it very clearly on the theme, access to service, mental health in catastrophe and emergencies. Of course, Namibia, we are aware of some emergencies when we talk about drought, and we are just talking about fire that has happened as a Etosha. And of course, we are also talking about fraud, and we are also talking about road motor vehicle accidents. We are talking about suicide, and we are also talking about gender-based violence. So now this access to service. In fact, if you look at what the cabinet on their 22nd meeting of 2025, that there was an approve that all offices, ministries, and all other enterprises, they must make a space. And somebody just called me to say, can somebody explain what does the cabinet want to tell us when they say we must make a space in the ministries? And in fact, it's like creating a space, and somebody has a misunderstanding to say, are we now going to have a mental mini hospital in our in our offices or ministries? What this means is, now when somebody is in crisis, where does that person go? Because there are many things that can happen. You may be at work and you hear that your brother has committed suicide. You as an individual, how will you react? And who's going to be there to assist you before the next professional come into your life?
Right.
So the theme is aimed to highlight the critical importance of ensuring that mental health support and services are accessible during the time of crisis. And also that we need to observe the day with emphasis on the need for the comprehensive mental health services in various situations where individuals may experience this mental health crisis, especially in terms of stress and also trauma. We have talked about after MVA, what happened, fire, sudden loss, especially to suicide, in case of rape, and also gender-based violence. So the campaign will encourage us to discuss the accessibility of the services and also to promote widespread where somebody can go. So I was very impressed when now they said, I am aware that there are wellness officers in various offices and the ministries.
Right, right.
But what are their duties and the responsibility? They are more focusing on something else, but they are forgetting about people with mental illness. Because people don't speak, especially if the person is suicidal, they never mention to anyone, they keep it to themselves. But then during the month of September, we are also talking about people to recognize the symptoms. If it's a colleague and you see them withdraw, and they are not even productive, and they are not happy, something is going on. But now we also have this culture of not speaking out so that the person will identify your problem. And if the person volunteer and ask, Nina, are you okay? Do you have a problem? It's like they are interfering into your life. But you are not speaking out so that you can seek help. And sometimes also people don't know where to go when they need that help. And now with this initiative, I'm very happy that at least the appointed wellness officer in different ministries will be able to assist and refer. So then also the campaign we are carrying out is that we have got given a mandate, and this is an initiative done by the Prime Minister of this country, that as of the 13th of October, there is already a list that is going to be published that each and every ministry and every offices and government agencies are going to be visited by the professional who are going to talk about mental health, and they will also going to identify those key persons in the ministry, and they will be known by their staff members to say, in case when they are in crisis, where should they go? So the official launching is on the 10th of October. That will be a Friday, and it's going to take place at UN Plaza, Katutura. This will be the first. We have a march which will be taking place from Katutura ShopRite, and they will be assisted by the Nampo brass band, marching from ShopRite to the UN Plaza. And the main speaker of the day will be of course, our Prime Minister, Dr. Ngurare himself, and the Minister of Health will also be speaking, and of course Dr. Banda from the World Health Organization, and they will also be performing artists, and their message will be talking about mental health, and especially also they will be talking about suicide, as we are all aware that suicide is really a problem in our country.
I wanted to ask Dr. Ndjaba, you mentioned, of course, that now government offices and agencies are required to create this sort of safe space within the environments to allow people to feel comfortable talking about what it is that they're experiencing. But I wanted to ask you how much stereotyping and also just, how we view the topic of mental health contributes to, the situation continually be perpetuated as something that is negative.
In fact, if you look at the theme for suicide prevention, it says that changing the narrative on suicide, turning awareness into action, and breaking the silence and the stigma. In fact, I want just to bring to the attention, breaking the silence and the stigma. What happened is that people come with this stigma and shame. So therefore, people don't want to speak. And therefore, I was even thinking now when we are talking about this space, will it not get a connotation, a name? Like, for instance, if you look at the mental health services unit we have in Oshakati, they always make a reference, Ward 16. This is a patient for Ward 16. But other patient who has been admitted to any other wards, they are not, those wards are not attached to them.
Right.
Of course, when you look also the facility that we have in Windhoek, the mental health care center, I even not happy when they call it Groendakkies Markamp. So, and I also want to encourage that when these spaces are going to be created into the ministries, it should not have that connotation of a negativity, because the reality is now that we are really having a crisis. That's why when you look at the theme of this catastrophe and the emergency, it means that the mental health services has become now a problem and is more of emergency, and we have really to take it very serious. Because we should also remember, as much as people do not want to be associated with It does not choose. Any one of us can suffer from mental illness. And when now you are affected, that is the time you are looking for a perfect place, which we don't have. So therefore, these services should not be left alone to the Ministry of Health and Social Services. It should be a stakeholder's responsibility. And I'm very glad, again, I'm repeating that at least when the ministries has got those spaces, places where somebody can go and explain how they are going through, even if they do not know the signs and symptoms, but somebody is in distress and somebody need help. Somebody is in crisis. Where should this person, who is the first contact person? The wellness officer in that ministry should become, and that person must, should I say, should take oath, because the people sometimes they want to go and explain, but they are not too sure
about confidentiality.
Their information, whether are not going to be shared with another person. But I'm sure the wellness officer, majority of them are social worker, professional trained, and they are aware about that. So therefore, they should really be there to assist the community.
In line with this year's theme, Dr. Ndjaba, talking about crises, what are some of the key challenges that Namibia, faces in ensuring that mental health services remain accessible during these crises? Because we do see during crises and some of the, examples that you mentioned, that physical aid takes priority.
Yeah, for instance, what we are trying to say is that we, even during the week of the 13th until end of October, we are going to share with the contact numbers, because not everybody would want to go to the state facility. Sorry, and we tend to believe that some of our people have got medical aid, although we are aware that we are told to go to the state facility even if we have got state medical aid. But it should be left to the choice of the public to choose where they want to go. Of course, there are psychologists, social workers, psychiatrists, and the other people who can assist. Of course, we also have got Child Lifeline, and we have got other agencies and other groups, like we also have got men, young boys and men. I think there was somebody who was on Good Morning Namibia. They are there, of course, to assist, and the people must know where to go so that they feel free and to go where they feel comfortable. And we are also putting pressure as the advocates. We are putting pressure on the decision makers to make sure that the services are available. Not just talking to someone, but infrastructures, staff. We do not have enough staff to cater for mental health services because of the stigma still. We also want people to speak openly and discuss about their mental well-being. Because if they don't talk about it, nobody will know. And the only thing that will observe or hear is somebody that have committed suicide.
Dr. Ndjaba, just in conclusion, we are out of time. Your final remarks this evening to Namibia and our viewers as we commemorate World Mental Health Day.
I would just wish to invite the public to please join us for the commemoration of World Mental Health Day on the 10th of October, UN Plaza, Katutura. The march will start at 7 o'clock, and if you are not able to join at 7, and the official will be at 9 o'clock at UN Plaza, Katutura. Please join us and feel free to reach out, and don't be in isolation, and just stand up, speak up, and get connected.
Thank you so much.
You're welcome.
That was Dr. Hilen Ndjaba speaking to us there about World Mental Health Day, commemorated on the 10th of October.